This motherfucker don't miss.
No, he's fucking good.
That motherfucker don't miss, man.
He's good.
In the heat of battle, he don't miss.
Pooping during childbirth. It's a highly requested question. Let's normalize pooping during childbirth. Because you know what? That means that you're pushing the right way. Especially if you have an epidural, you can't feel barely anything down there. I always tell my patients that have epidurals, if you feel like you have to take the biggest poop of your life, press that call button and let me know, because it probably means that that baby's like right there, about ready to be born. And if you poop, you won't know, because I take a little washcloth, wipe it away, throw it out, go on with our lives. We like to see it. It's like I said, it means that you're pushing right. We get that baby out better.
Finally! I've been trying to catch you boys all day!
When the sky comes falling, even the sun don't shine, I got faith in you and I, so put your pretty little hand in.
It should take about an hour.
Doc, what size gloves do you wear?
12 and a half, 12. It normally doesn't take me this long. It's too hot in here. EBL is 5.
Is that milliliters or liters?
I don't recall throwing anything or calling him that.
What I love, Nestle Crunch.
When the sky comes falling, even the sun don't shine.
And here we go. I hope you're hungry for nothing. Now.
So sperm is made out of glucose. Does anybody have any questions? Yes, Danielle? So you're saying that a sperm has sugar? Yes, technically yes. That's weird. So why doesn't it taste... Excuse me? What?
Hey man, do you touch my drum set?
Nope.
It's just weird, because seems like someone definitely touched my drum set.
Yeah, that is weird. Because I didn't touch them.
Hey! Did you touch my drum set?
Hey, knock it off!
I know you touched my drumstick, because the left one has a chip in it.
Okay, this is what I think that you wore to school in the early 2000s based off of your nursing department. Med-surg, you guys were pants and skirts kind of people. This whole outfit is a hot mess, and that perfectly describes that department. Women's labor and delivery, you guys wore this unicolor tracksuit that was soft, that we all had one of. If you specifically work in labor and delivery, then I imagine that it also had the word juicy written on the butt. I don't know why. I see you. Y'all had the low rise with the fishtail thong popping out the bag. ER, I firmly believe you went through a weird half-hearted punk phase. Rehab, I don't know how I know this, but I do know that a lot of you guys had this weird vest thing. I don't know why that we wore those. Those were not attractive. Then OR, recovery, all of you guys, did you guys wear your tiny, thin, useless scarves on your neck or waist?
Greetings, ladies and gentlemen. Today I'm going to talk to you a little bit about EpiPens. On an EpiPen, you'll see it says, after use, most of liquid stays inside auto-injector and can't be reused. Delivers 0.3 milligrams intramuscular dose of epinephrine. However, did you know that it leaves 1.7 milliliters of epinephrine inside after use? Hypothetically speaking, this epinephrine should never be used and be discarded and replaced appropriately. But if you were ever to find yourself in a life or death situation, it is possible to obtain 5 additional doses of the epinephrine. As you can see, I've cut the tube which releases the safety spring. This leaves you with the syringe filled with about 1.7 milliliters of epinephrine and a plunger. On the plunger itself is a white stopper that makes it impossible to administer more epinephrine unless you remove the plunger, completely creating a new air pressure. However, the syringe itself is not graduated, making it impossible to know how much epi is actually being administered. If you can, draw it up with 1 ml syringe.
What are you doing? This came loose. What came loose? This.
Respiratory, this is Greg. What's up? Yeah, I'm in 284 with Mr. Smith. The ventilator is making some funny sounds. Like what? Like I don't know, something like that. It's weird. Can you put the phone up to it so I can hear? It's not doing it anymore. I hit some buttons and it stopped. What did you press? I don't know, but the family is here and they're happy it stopped. I mean, it's good that it stopped, right? I'm coming right up.
Oh, wait. Something's happening.
I'll be right there. Don't touch anything.
Maybe he needs some albuterol.
I'm almost there.
Oh my
thank you
gosh,
so
you did
much.
so great.
Oh my
Wonderful,
gosh, you did
wonderful.
such a
That
great
was
job.
good
Thank you
thinking.
for
You're
calling
the
that
greatest
guy.
nurse ever.
Thank you.
Greatest nurse ever.
Greater is coming. Greater is coming. Fear can't have me. Doubt can't have me. Depression can't have me. Comparison can't have me. Jealousy can't have me. A pessimistic mindset can't have me. Greater is coming. Greater is coming. I ain't got time to be negative. Greater is coming. I ain't got time to be.
Nobody fucking warned me that nursing exam questions were going to be like, alright, your patient has flatlined. What do you tell the patient's family? A, the patient has died. B, the patient is dead. C, the patient is deceased. Or D, the patient has passed away!
What we actually gossip about in the break room.
You know, we could have been strippers. Making a lot more money right now. Same time of night, shaking ass, not wiping ass. What would your stripper name be? Do you guys know? Bougie Boy?
On today's episode of Facebook Regional Hospital. Hey, I started 6:05 when urine therapy for UTI. Sounds right, just make sure it's filtered. Code blue, detox room. Grab the cart, people, I need help. Someone tell me what happened. 27-year-old anti-science, anti-vaccine VFib. That's like 117 years old in vax years. Stop compressions, you're knocking off the chakra. What do we do from here? Okay, you on prayers, you on oils, and can somebody tell me what the fucking sage level is? 6 drops of tea tree oil administered. Resume prayers. Shit, he's still in VFib. Did someone page God, let him know it's in his hands? We paged 3 times today, we couldn't get an answer. John, your prayers need to be harder and faster. And where's respiratory? I need to nebulize some lavender. Alright, foxglove plan administered. I feel a vibe, people. We got a vibe. Alright, good job, people. Strong thoughts and prayers.
So I was cleaning up my daughter's room, throwing away stuff, decluttering, and I came across a paper that she did in the 3rd grade. And it said, like, what does your mom do for a living? What does your dad do for a living? Under what does your mom do for a living, my daughter wrote, my mom sleeps all day long. If we wake her up while she's sleeping, she gets very mad and she yells at us. I tried to give my mom a hug when she got home from work, but she said she needed to take a shower first because she had lots of people's body fluids on her. So my hug would have to wait until she got clean. My mom is a nighttime worker. Did my daughter's 3rd grade teacher think that I was a lady of the night for the entire year? And why the heck does a night shift nurse and a prostitute have so many similarities?
Hi, girl. What's up, Tracy? What you doing, girl? Good. Nothing. Sitting this thing on the computer doing my rounds. Good. It sound real busy. What y'all got going on? you know, one of the new girls that came over here telling me some, girl, you know, stay here. Girl. Stop to stress herself out. I said, baby, calm down. Right. Just relax. Girl, right. It's packed. It's, lady, baby, it is packed in here like it's Black Friday. Girl, you lying, girl. You know what a DON and everybody down here acting like they done been dead something. I ain't seen them all week. Typical. Girl, you know how they do. I ain't even worried about it though. Hey, how are you doing, ma'am? Hold on, girl, hold on. Hey, how you doing? Hey, my name is Mike Speck. Nice to meet you. My name is Tracy Mack. Nice to meet you. Okay, cool. Hey, what are you doing? You said, what am I doing? Yes, ma'am. I was on the phone with one of my coworkers, and I'm doing my rounds and watching my residents. Do you by any chance have a mask? Yes, I have a mask. You see it right here. It's right here. Is there any reason why you don't have it on? I just don't have it on right now. Can I ask a question? Sure, go ahead. Why don't you have your mask on? Matter of fact, you don't even have one around you. I mean, you don't have one in your pocket, nothing like that. I mean, I feel like, I know y'all state, okay? But I feel like y'all are still obligated to wear masks when you come in, you know, because we don't know if you guys are sick or not. I don't know if you got tested or whatever, but we're trying to protect our residents, like, you know, because, like I said, I understand that y'all state, but we still have an obligation to make sure our patients are well taken care of and make sure whoever comes in here wear masks. So is there any way y'all can find a mask or go get a mask, something like that, if you don't have one in your pocket? Yeah, we can go get one. We can get one. That'll be fine. So what do you do here? What do you do? What do I do? Yes, ma'am. I do my normal duties. I mean, I'm sure you guys know what CNAs do, right? Yes, ma'am, we do. Okay, so I do what CNAs do. I take care of my patients. I give them baths. I do I do my rounds. I wash clothes, wash asses. I mean, you name it, I do it. Well, there's no need to get smart, ma'am. No need. I'm not getting smart, sir. All I'm trying to get you to understand is you trying to ask me about my job and ask me about a mask when you don't even have your own mask on. Don't none of you guys have masks on. So I'm gonna need you guys, since I work here, okay? I work here with these residents, so I'm gonna need you guys to go get your mask from the front desk that you pass by without getting the mask, and then you can come back and talk to me, all right? Well, can I just finish up so I won't have to come back? Listen, sir, you about to get this clap, okay? Because I'm so sick of y'all thinking y'all just finna come in here and like y'all run things, baby. Y'all don't run nothing in here, okay? Y'all don't run nothing. All y'all do is come in here and basically inspect. Baby, you see my resident, they fine. Okay, but I'm gonna need you to go get a mask, okay, before we even get to talking. Matter of fact, I'm gonna put mine on, because I don't know what you got, all right? So please, so just go get a mask and then we can talk when you come back. Yes, ma'am. Yes, ma'am. Thank you. You too, ma'am. Don't none of y'all got on no mask. I'll see y'all in a minute. Jesus. Hello. Girl, they walking up here trying to talk to me about a mask and ask me what I do as a CNA. Baby, y'all know. Y'all need to go get a mask. That's what y'all need to go do. That don't make no sense. They get on my nerve, but I'm gonna call you back. All right, go. Bye-bye.
God! Is it? It is! The mega bitch!
Things I think about while watching medical TV shows. I don't think I've ever seen a doctor touch an IV pump before. Why is the bed so high? Why are all the bed rails down? Is the call button within reach? Wow, that room is huge. You can actually